Discovery Health says COVID-19 deaths could spike if there's a third wave. The insurer says the second wave has had a huge impact on its target market. Now, for more on this, we're joined by Emile Stipp, Chief Actuary at Discovery Health South Africa. Emile, thanks for your time. So, Discovery has raised some concerns about a third wave and more people dying if South Africans attend super spreader events and don't wear masks. Take us through what your actuaries have calculated.
Thank you, Shahan, and good evening to your viewers. So what we did when we looked at the data from end of November and beginning of December is we saw that there was effectively a national super spreader event with the start of holidays. And we can see from our data how that spread through the population. So what we're saying is that if the same happens around Easter, then we do foresee that there's a possibility of a third wave occurring. And that's what we put in the models. I think if the measures are in place and if large social gatherings are still avoided around that time, also going into winter, we can possibly avoid a third wave. But what we quantified there was just effectively what could happen if that's not the case.
Yeah. So how bad is it looking, though, if those precautions are not followed?
Well, it depends on a lot of factors. What you should remember is that obviously we had a second variant emerging in South Africa at the time that nobody knew about. We only really found that out later on in December. It's a combination of those things that played a role and created the second wave in South Africa. The scientists tell us that there is a possibility that the virus mutates again. So if it comes together with large social gatherings, then there is a fairly good chance that it develops. On the positive side, maybe positive is a strong word, but we have also said that a lot of South Africans have actually already been exposed to COVID. So those two factors play off against each other. And the third factor that comes into it is the vaccine campaign. So as we know, government is working hard on rolling it out. There's a lot of cooperation between the public and private sector. There's enough budget set aside for the vaccine. If we manage to vaccinate the old and the sick by winter, what we've modeled is that reduces the impact of the third wave by more than half.
Yeah.
So it's all these different factors that play a role.
I'm going to talk about the vaccines in a moment, but just regarding the claims you've received, talk us through what you're seeing there.
So it is interesting. We are seeing, in the second wave, we certainly saw that our members were more vulnerable to infection. The one thing that I think a lot of people are concerned about is that if you had COVID once, would you be reinfected by it? And what we can see from our data is that actually the probability is fairly low. It's only about 0.8% of people who get reinfected. So the combination of having been infected in the first round, and then whether you get exposed to the virus in the second round, that determines how many people get infected. We had only about 600 of those. What we did see also is that whilst the admission rate was a bit higher in the second wave, the length of stay was shorter. So we've seen improvements in medical treatment all the way through the epidemic. And basically, our members have benefited from that, also from how medical protocols have changed over the world. So I think all of those effects we are observing in the data.
Yeah. So in terms of vaccinations, government, of course, hoping to inoculate over 1 million people by the end of March. But that's just healthcare workers, it seems. Does it in any way slow down the infection when it comes to a third wave?
Yes, I think it would actually play quite a significant role. You must remember that healthcare workers get exposed to the virus more frequently than others. That's why across the world, healthcare workers are vaccinated first. But I think beyond that, it's actually 1 million is already a lot more than there are healthcare workers in the country. So it's basically, it will start with the old and the sick and the vulnerable, people with comorbidities and older people. And because the mortality rate is that much higher for the old and the sick, what you basically see then is that the mortality rate comes down dramatically. So when we look at our experience in the UK, particularly deaths in care homes, in old age homes, have dropped dramatically, very quickly after the vaccination campaign rolled out.
Yeah.
So there is some hope that the same will happen in South Africa.
And lastly, just let's continue with this vaccine point. Of course, the pace at which government's securing the vaccines and rolling it out, some would argue, has been slow. Is Discovery considering buying privately if allowed?
So we will work with government and do whatever is possible. Obviously, we have set aside sufficient reserves to cover the vaccines. But I think that the process always has to be very tightly controlled by governments, not only in South Africa, but across the world, to make sure that the vulnerable gets vaccinated first. So we will work with government and certainly pay for it and take up our line, our position in the line at the correct spot and fund the vaccines for our members.
All right, thank you so much for your time and your insight. Appreciate it. That was Emile Stipp, the Chief Actuary of Discovery Health South Africa.